Why do some people get everything on silver plate while others have to struggle just to survive? This is my life story. I am Neha. I am 24 years old. I have grown up in a small town and now I have shifted to a PG. I used to be really active and a happy person. My family was very supportive in all my activities. But things started to change. Hello? Tell me. Today I'm unable to come to college. I'm feeling feverish. My temperature is very high. Okay, I can't come. I will take rest at home.
Myself Sarala. I am 35 years old. I suffered a lot during the hard phase of my life. Initially, it started with a joint pain. Later, it turned out to be a major problem. I was not able to do routine chores. My days used to start by taking painkillers. It used to make me tired.
I used to get fever often and reduced only after taking antibiotics. Later on, I started experiencing hair fall. When I discussed this with my mother, she said it could be because of stress and she advised me to apply hair oil. I did what my mom said, but it didn't work.
Morning, I used to have joint stiffness. Because of this, I was not able to flex my fingers. I was not feeling like eating and used to get tired easily. I felt like taking rest.
I'm having a headache. Get me a coffee. Hey, I'm talking to you. I said get me a coffee.
When did you come?
I came long back. Where is your mind?
I was not able to do any work. I am not able to open even jar lid. Initially, pain was only in fingers. Later on, my knees also started paining. Even for a small task, it required the help of someone else. Hey, please open this jar lid.
Oh, every time you call me for such small things.
I used to get tired a lot and was not able to concentrate on any work. Later, joint pain and body pain started. I was not able to eat anything because of my mouth ulcer. I started taking antibiotics and paracetamol. Fever used to reduce only on taking medicines and would reappear once I stopped medicines. I had no idea what was happening, but I used to take medicine regularly without fail.
My condition began to worsen until it became difficult to bend my fingers. I visited doctor. Doctor, my fingers and joints are paining. I am not able to bear it. The pain is so much that it's impossible to handle. I am not able to fold my fingers. And I am feeling tired all the time. I can't able to wash the vessel and clothes.
Nothing is happened. You are completely normal. Symptoms might be due to less hemoglobin. Just take calcium iron tablet. You will be alright.
I started taking tablets, but the pain did not reduce. I lost hope of leading a normal life.
One day, I developed rashes on my skin and face. My joints became swollen. I was scared. I don't know if I'll be okay. I'm scared, Mom.
Go and consult Dr. Neha.
Autoimmune rheumatic diseases needs an early diagnosis. Identifying this disease when it is having minimum symptoms is one of the critical steps in appropriate and right management of these diseases. Symptoms could be very subtle, it could be very mild, and that's a point where one need to approach the right diagnosis and start and initiate the right treatment.
Hello,
Good evening, doctor.
how can I help you?
Doctor, I'm tired from last few days and I'm not feeling hungry. I'm a student, but I cannot study and do anything. I'm not able to do any work. My joints hurt. And since today morning, I'm having skin rashes.
Did you have fever?
Yes, doctor, I had fever for a couple of times, which reduced on taking medications.
By looking at your symptoms, I think you have lupus. But do a blood test for confirmation. After getting reports, come and show me.
Okay, doctor.
Till then, I will prescribe some medicines for symptomatic relief.
The laboratory plays a very important role in diagnosis of autoimmune disorders. Lab tests are important because earlier you diagnose autoimmune diseases, earlier you treat them, they respond better and they can lead a disease-free life. So that is the reason where autoimmune tests are becoming very important now. Laboratory investigations help not just in diagnosis, but they also help in monitoring. In patients with autoimmune disorders, we use markers for which assess the inflammation very commonly when they are giving the therapy.
Later on, my neck, my back, honestly, whole body started paining. My fingers became stiff, along with a severe pain. It was hell to move even one step. I used to feel like I'm walking on thorns. All my friends and relatives were happy and traveling, but I was suffering and living with the pain. Every day, my son used to take me to a park for walking. But after moving a few steps, I used to sit immediately. When people used to look at me suffering from this, I used to feel bad. Many people were so happy walking in the park and playing with kids. Even aged people used to walk. My condition was different. Everyone used to give me suggestions. I was fed up.
Neha, you have SLE disease, means systemic lupus erythematosus.
I was diagnosed with SLE disease.
SLE is an autoimmune disease where your immune system attacks your own body, causing these symptoms. This is a chronic disease. It might be mild or even severe in some cases.
Doctor, give me more information about SLE. What I have to face in future? I was scared. I was afraid of my future.
SLE symptoms are fever, tiredness, some might get joint pain and swelling. You might have hair loss, skin rashes, dryness or mouth ulcers. But no need to be afraid. You may get fever quite often.
I was devastated. I had lost everything because circumstances were beyond my control.
I was starving because I was not able to prepare food myself.
Why? Why are you so upset? Are you not feeling well?
I took tablet which doctor prescribed, but still I am not getting well.
There is a hospital nearby. Go and get a detailed checkup there, okay?
Okay. I took vitamins and calcium tablet. Still I was not able to open even a refrigerator door. My fingers were so stiff that I was unable to hold a single egg. I pray to God that no one should get this disease. Doctor, what happened to me? Morning my finger used to get stiffened and swollen. It pains extremely, doctor. I am getting headache. And all my limbs are paining. Even the joints are paining. I don't feel like eating, doctor. I have lost my weight also.
The disease you have is rheumatoid arthritis, which means arthritis and joint pain. You know, it mainly affects your joints. The symptoms of this disease are morning joint stiffness, joint pain, tiredness, and thirsty, which you might experience. If you take treatment properly, it reduces within 2 to 4 years. You also need to do physiotherapy exercises. As the symptom reduces, we decrease the dosage of the tablet. If you don't take the tablet, the chances are high that you might get joint deformity. Even if the disease subsides, you should take tablet. Don't go off the pill by yourself. You should be in a positive mindset,
When doctor said I am suffering from arthritis, I was devastated. All I wanted to get back to normal. I was ready to receive that doctor will advise. I made myself strong and increase my self-confidence.
Autoimmune rheumatic diseases are some of the common causes for disability in adulthood. Important aspect of managing rheumatic disease is ensuring compliance. The drugs work only when it is taken regularly. The autoimmune diseases can be very disabling. Pain is an important aspect of the disease, but these diseases also affect many organ systems including kidneys, lungs and heart. So if one doesn't take the medicines regularly as prescribed by a rheumatologist, the disease can come back after it has got very well controlled. Sometimes when the disease relapses, it is difficult for the doctors to achieve a control again. So it is important to ensure that you take the medicines regularly.
Nowadays, the treatment is good. If you take treatment properly, you will be able to lead normal life. Some patients might need lifelong treatment. In others, we can gradually reduce the doses when symptoms reduce. But you should take treatment properly. And you should be ready if need to take lifelong treatment. Don't lose hope. Be strong.
I had undergone psychologist counseling, and they helped me to gain confidence to fight against this disease. I watched interview of other patients and made myself strong.
My hands and face got swollen and I gained nearly 100 kgs of weight. After taking treatment, now I don't have any problem. Now sometimes I get pain. I am on medication and I will continue taking medicines. There was a time when I lost all the hopes to become normal, but the doctors put me confidence and made me to believe.
Initially, it was difficult to get adjusted to the tablet.
We will assess your whole body. What are weakness in your muscles? Which joint has the pain? In which joint range of motion is less? We assess each one. After assessment, we will provide proper protocol. Accordingly, we will teach you exercises. You have to follow that. Initially, you might feel difficult, you will get the pain, but you should not stop the exercises. The tablet should be taken properly. Exercise should be done regularly. Only then you can come out of the sick and you can lead the normal life. If you get any difficulty in doing exercises, approach the physiotherapist and get the alternate exercises. But you should not stop the exercises and exercise should be done regularly.
I was doing exercises which physiotherapist taught me and took all the treatment which doctor advised. Still, I was wondering, will I be able to become normal again?
When I showed my illness to the doctor, he told me to get the blood test done. After test was done, I showed to the doctor. He started the treatment. The disease started to subside. There is no need to afraid about this disease if you take the tablets as the doctor prescribed.
But doctor gave me some medications and he told that I should be fine with all those things, with those medications. And finally, when I started taking them, I was out of the hospital after my portal vein thrombosis, that is ballooning. And I started doing it slowly, immediately. I found the difference in me. I got the difference. I was able to eat any food and there was no bloating in my stomach. But till date, there has been no such problem. But the solution is I've been continuously following up with the doctor and taking all the medications properly as suggested by him. And that has really worked out for me. I'm leading a very much a normal life. In fact, nobody other than me can find out that I am having some disorder. And that's what I would like to say, that autoimmune disorder does have a solution. Please don't be under the myth, like even I too was from the year 2004 to 2008, that there is no solution for my problem. I'm going to face such health issues one after the other. That was my mindset. But after consulting the doctor and taking medications and with regular follow-up, and it does help because it has helped me.
From past 7 years, I am suffering from this disease. When I consulted doctor, they prescribed medicines. I used to feel better after taking those medicines. Once I stopped taking medicines, the disease aggravated. My hands and fingers became stiff and swollen. I was not able to bend them. I was not able to walk because of swollen legs. Only by taking medicines it got reduced, or else it would have been worse.
My name is Sumitra. I am 62 years old. I am suffering from rheumatoid arthritis. Initially, my hand was swollen and could not able to flex my fingers. I could not able to do my own works. Later, I consulted a doctor and started taking treatment. Now, from past 15 years, it's under control. For everyone who is suffering from this, please get doctor consultation and get treated.
Initially, it started with a leg pain. Morning, I used to have joint stiffness and I could not flex my fingers. I had swelling too. I could not do daily activities. Then I consulted local doctor. I came to know that I have rheumatoid arthritis disease. They explained me about rheumatoid arthritis and advised to take the treatment. Slowly my health became normal. Now I can do all the daily activities.
As doctor suggested, I did exercises. Because of that, I was recovering. Even though I used to get lot of pain, I did not stop doing exercises because doctor advised not to stop exercises.
I'm not married yet. How should I lead my future? Will I be able to get pregnant?
Once symptoms reduce, you can get married and also have children.
So the first thing I want to tell you all that there is no problem with fertility in patients of lupus, both men as well as women. That means that the capability to have children for lupus patients is absolutely normal, provided that we pre-plan the pregnancy. That means it should not be an unplanned conception. Now we all know that pregnancy is not something which can always be planned, and unplanned pregnancies do happen. Actually, in general population, as many as 1/3 of pregnancies are unplanned. But in case of lupus, it is of utmost importance that the pregnancy is pre-planned in consultation with the rheumatologist, the family members, and of course the obstetricians.
I became so weak. I'm not getting confidence, Mom. Tomorrow I have doctor appointment. As the days passed, counseling helped me to gain confidence. With the treatment and exercises, I started feeling well. I didn't give up. I faced everything. I constantly fought against the disease. With the help of exercises, my joint stiffness reduced gradually.
I did not give up. I took it as a challenge and decided to fight against it. And I wanted to live my life at its fullest. Gradually, my pain reduced. I started to do my work myself.
Rheumatology and treatment of rheumatic diseases has undergone sea change in the last 4 decades. Definitely, the quality of life has improved due to the use of new drugs like biologic disease modifying drugs, as well as combination therapies and the use of appropriate use of steroids as and when required, along with JAK kinase inhibitors. It is now very, very important to start disease-modifying anti-rheumatic drug as soon as you diagnose the patient and start treatment and treat the disease very aggressively to prevent any deformities, disabilities. Like rheumatoid arthritis, other autoimmune diseases also have undergone a sea change due to the development of the new drugs. It is satisfying to see that patients do know that now to a significant amount. They need to see a rheumatologist for their problems. The awareness among the general population as well as the medical population was very low. But last few years, particularly last decade, due to the efforts of our colleagues across the country, the awareness of rheumatoid arthritis and rheumatic diseases has gone up significantly, and we are able to do justice to our patients. I only wish more and more patients participate in awareness programs of the Indian Rheumatology Association and spread the knowledge and awareness that if you have rheumatoid arthritis, you must go and see a rheumatologist or an orthopedic surgeon.
Oh, very good. Your blood report test looks good. Your kidney functions are all stable. Inflammatory parameters are normal. How are you feeling now?
I'm feeling good, doctor.
Very good.
Now, I think I'm winning against this disease. However, sometimes symptoms appear, but now I'm not afraid because now I'm mentally strong than before. Living with SL is a challenge, but with the right treatment, support and willpower, we can overcome it. I have learned to listen to my body, and I will never let my illness to define me.